Healthcare tops the list of critical infrastructure targeted by cybercriminals. These threat-to-life crimes hit every hospital hard, but rural providers even harder due to fewer resources and generally smaller IT staff. The average recovery cost from a ransomware attack is $11 million, a vast sum that leaves many rural hospitals one cyber attack away from closure. In today's podcast, we hear from John Riggi, the American Hospital Association's National Advisor for Cybersecurity and Risk, and Justin Spelhaug, Corporate Vice President of Tech for Social Impact Microsoft Philanthropies, about the steps rural providers can take to reduce the risk and impact of a ransomware attack.
I'm Justin Spelhaug, the Corporate Vice President of Tech for Social Impact here at Microsoft Philanthropies, and I'm joined by my co-host, John Riggi, the National Advisor for Cybersecurity and Risk at the American Hospital Association. And we're here today to discuss critical issues of cybersecurity in rural hospitals and how our partnership is coming together to tackle the challenges that so many rural hospitals are facing across America. So thank you for joining us. And John, thank you for joining us. Good to see you here today.
Good to see you too, Justin. It's always great to partner with you.
Well, John, as the expert in hospital cybersecurity, can you tell us why rural hospitals are particularly vulnerable to cyber attacks?
Justin, great question. There's really a number of factors about that. First, the impact of the physical distance on patient care and mortality when a hospital is shut down by a ransomware attack. For example, rural hospitals provide critical health services to about 60 million Americans, or nearly 20% of the U.S. population. Rural residents already must travel more than twice as far as urban residents to reach the nearest hospital. So when you have this increased travel distances, they are directly associated with higher mortality rates for time-sensitive conditions like heart attack, stroke, or trauma. And then you're diverting these patients during a ransomware attack, again, just magnifying that risk. Then there are the resource challenges, financial constraints and skill shortages, low operating margins due to patient volumes, high fixed costs relative to urban hospitals. And rural hospitals are more likely to have older technology and smaller IT support staff. This impacts the resources to implement key cybersecurity measures, creating really, unfortunately, an ideal opportunity for exploitation for cyber criminals. The average cost of addressing cyber attacks, now this is the cost after you've been attacked, the cost to recover, is almost $11 million. I mean, just an enormous, staggering amount for the average rural hospital. 30% of all rural hospitals are already at risk of closing, so they can be only one cyber attack away from closure. And then, of course, as I indicated, there's a skills shortage. Very difficult to get your best cybersecurity professionals to work in rural areas. The salaries are generally not as competitive as urban areas or even other industries. So you compile that, it's extremely challenging to get good, experienced IT staff to work in rural America. And then we have geopolitical factors making rural hospitals kind of unique targets. So over the past 12 months, cyber attacks against hospitals have increased about 130%, making them the top critical infrastructure that's targeted by cyber criminals. And make no mistake, they know when they target a hospital, lives are threatened. In fact, there's now even evidence that nation states are collaborating with criminal groups. Justin, I know Microsoft keeps a very close eye on the evolving threat landscape. Can you talk to us a bit about the trends you're watching that might affect healthcare organizations?
I can. And John, thanks. I mean, your feedback that hospitals are only, one cyber attack away from closing, especially the rural hospitals that are very stretched, is just really eye-opening. And when we look at the challenge facing hospitals, but frankly, many different kinds of organizations, one of the reports that we produced is the Microsoft Digital Defense Report. Now, we use about 78 trillion security signals a day from Windows and cloud endpoint devices to inform this report. We've got security engineers and intelligence analysts tracking about 1,500 unique threat groups all around the world. And the trends I'll talk about here are relevant for every industry. But as you said, John, it's impacting healthcare and it's impacting rural healthcare in particular. Let's talk about a couple of the trends. The first one is that we're continuing to see a massive escalating intensity on password-based attacks. When we look at our Microsoft Entra data, we see organizations being barraged by about 600 million identity attacks per day, and 99% of those are password-based. Now, advances such as zero trust architecture, conditional access policy, MFA have helped defend against this. But we're seeing hackers work around MFA, targeting infrastructure and applications and bypassing authentication altogether. And that's why advanced monitoring and threat detection capabilities inside of an environment are so critical. So that's the first theme. The second theme that we see is nearly a 3x increase in year over year human operated ransomware attacks. They're attacking healthcare, they're attacking rural hospitals, they're attacking nonprofit, they're attacking schools, they're attacking sensitive government infrastructure. Now, on the good news, if there is any good news anywhere in this story, is we see a significant decline year over year in attacks reaching the encryption stage and locking up resources. And that's because of the deployment of automated attack disruption tool. It is also endpoint protection deployment. 92% of all successful ransomware attacks involve the attacker going through an unmanaged device on the network. And it's also about increased training and awareness across the employee base in every organization. But we need to keep making progress because, as you know, John, you said the average recovery was about $11 million of investment. When they break through, it's devastating. And for a rural hospital in particular, it's devastating. We're also seeing a third theme, and that's the ingenuity of fraud tactics are quickly evolving. We saw growing sophistication of investment scams, tech support scams, and particularly impacting hospitals and more. At the same time, we're seeing impersonation getting more sophisticated, in fact, and detection more difficult because of the access to deepfake technologies that cyber criminals are using. And globally, the World Economic Forum reports that scammers stole over $1 trillion in US dollars from the global economy in 2023. So the massive impact. And then finally, John, something that you mentioned, nation states. We're seeing actually blurred lines between nation state threat actors and cyber criminals. They're partnering together to advance each other's objectives. And in particular, we're monitoring and see Iran, who appears to be the most active nation state actor targeting healthcare organizations specifically. Perhaps the most acute impacts and the biggest headlines have been in the health sector, certainly over the last 12 months. And when you talk about a small rural organization and a rural hospital, John, as you just did, with less resources, as you just talked about, to protect themselves and respond, we know why, hackers are targeting these organizations and why it is such a huge challenge for us here in the United States. So big challenges all around. Now, John, those are the challenges. Can you talk a little bit about the impacts you're seeing these cyber attacks actually have on hospitals and maybe even more importantly, the communities that they serve?
As you know, the AHA has been a very loud voice signaling what the impact is of these ransomware attacks on hospitals. Unfortunately, this isn't just about the protection and privacy of data. It's very important, but most importantly is the disruption to patient care. These attacks have caused significant disruption and delay to healthcare delivery when hospitals are attacked directly or through some third-party attack that results in a disruptive effect. And we all know that when there is disruption and delay to healthcare delivery, patient safety is placed at risk, lives are threatened. The bottom line, these attacks are not just data theft crimes, these are threat to life crimes. And again, they're not only going after hospitals, but after our mission critical third-party providers. For instance, the Change Healthcare attack, the largest, most consequential cyber attack against healthcare in history, compromised the healthcare records of 100 million patients, 100 million Americans, costing the sector $100 million a day, and then ultimately disrupting healthcare delivery. But it's not just the big organizations that are attacked. And of course, when a rural hospital is attacked, there's an outsized impact to the community they serve. Because these attacks, as we have seen, are not just attacks on the hospital as an organization. It's an attack against the patients inside the hospital and against the entire community that depends on the availability of that hospital. A couple years ago, we had an attack on Sky Lakes Medical Center in Southern Oregon. Their 90-bed hospital served about 120,000 people across 10,000 square miles. Their next nearest hospital, 72 miles away. And when this attack occurred and encrypted their systems, forcing them to shut down many of their services, there was very, very significant disruption. And that disruption lasted about 28 days. They had to use 60,000 sheets of paper for clinical documentation. Fortunately, they did not have to pay the ransom. They had the capability to recover and restore independently. But again, significant impact to patient care delivery. And even after it hired extra staff, it took some 6 months to input all the paper records into the system. So the organization spent about $10 million, a huge expense that was not covered by insurance, to overcome this attack. And we have to thank Sky Lakes Medical Center for coming forward to share best practices and lessons learned so we can all help prepare for the impact of these attacks. Unfortunately, I have many examples of how these attacks affect the patients in these rural hospitals, but also threaten the safety of the entire community. A couple years back, I got a call from a hospital in the Pacific Northwest, and they were talking about an attack that they were experiencing, but there were 2 other hospitals that were also under attack. And so their natural diversion points were no longer existed. And they said, John, we are very, very concerned because our next nearest emergency department is 125 miles away. Yeah. So, John, we've got a medevac parked in the parking lot, but where we are in this state, it actually snows in the winter quite a bit. And we're expecting a storm to come in. If that happens, that medevac can't fly. And if we get a stroke, heart attack, or trauma patient, that patient's going to have to go ground transport if it's even safe. And unfortunately, we don't think that patient would make it under those conditions. That's how deadly serious these attacks are. And that's why we always say and tell the federal government that these attacks, make no mistake, the bad guys know what they're doing. When they attack a hospital, they're threatening lives. These are threat-to-life crimes.
Thanks for listening to Part 1 of this podcast. Please join us on Wednesday for Part 2 as we continue this important conversation on cybersecurity for rural hospitals. Thanks for listening to Advancing Health. Please subscribe and rate us 5 stars on Apple Podcasts, Spotify, or wherever you get your podcasts.